Programming in early life for future health of the child.
Good afternoon, everyone. My name is Dr. Ayodele Rena. I'm a pediatrician, and in conjunction with the Nestle Nutrition Institute of the Central and West Africa region, I will be discussing programming in early life for the future health of the child. Metabolic programming goes hand in hand with the developmental origins of health and disease, and it's a concept that tries to explain how adult diseases such as diabetes, hypertension, dyslipidemias have their origins in childhood and as early as intrauterine life. Now, this concept is important because some human and animal models, for example, have demonstrated that infants who are born low birth weight are more likely to develop non-communicable diseases as their counterparts who were normal birth weight. So, in this discussion, I hope to highlight some of the factors that are responsible for this phenomenon that we're observing and why it is important for the Central West African region and how to prevent these non-communicable diseases through interventions that you and I as healthcare providers can institute. The concept of early metabolic programming might sound extremely esoteric, but it's actually quite relevant for the Central and West Africa region. And this is because in this region, there are a lot of countries that are low to middle income. Now, in these countries, there is a high prevalence of maternal undernutrition. Mothers who are undernourished are more likely to give birth to babies who are low birth weight. Babies who are low birth weight are more likely to become children who are obese, and children who are obese are more likely to become adults who are obese and who have non-communicable diseases as well. Childhood obesity is a problem that is on the rise, and unfortunately in the region we have a two-edged sword of both undernutrition as well as overnutrition. Now, childhood obesity has complications like fatty liver, like hypertension, pseudotumor cerebri, dyslipidemias, and adults who are obese are more likely to develop myocardial infarctions, metabolic syndrome, type 2 diabetes, dyslipidemias, and other complications that we are all too familiar with. The problem with these things is that it increases health costs for the region. So there is increased morbidity, increased mortality, increased hospital stay. Also, there is increased time taken off work, and all these things have their economic implications in a region that already has its economic challenges. Well, these factors can either be prenatal or they can be postnatal. For the prenatal factors, things like maternal undernutrition and maternal obesity contribute significantly to adverse metabolic outcomes. So for the mother who is undernourished, there is an intrauterine environment which deprives the infant of required nutrients. This leads to an increase in the amount of insulin that is secreted, and that in turn leads to central adipose deposition, insulin resistance, and type 2 diabetes later in life. For a mother who is obese, the infant is set on an abnormal growth trajectory. This means that she is likely to give birth to an infant who is large for gestational age. The large for gestational age infant is most likely to be an obese child. The obese child is most likely to be an obese adult with all the non-communicable diseases that we have listed. And if that obese adult is a female, she is most likely to give birth to another large for gestational age child, and the cycle becomes vicious. For postnatal factors, by far the most important consideration is nutritional. For example, infants who are fed on formula that contains excessive amounts of protein are likely to develop obesity later in life. And here's why. That amount of protein enhances the production of insulinogenic amino acids such as valine, isoleucine, and threonine. Now, these amino acids enhance insulin secretion in the infants. Insulin enhances the production of insulin-like growth factor 1, that's IGF-1, and IGF-1 leads to decreased amounts of human growth hormone production. It makes adipocytes more active, leading to adipocyte deposition and fat deposition, especially in the central region. It leads to decreased lipolysis as well. Now, this leads to childhood obesity and eventually adult obesity, as well as the non-communicable diseases that we have listed earlier. Well, the first thing is health education, and I think Nestle Nutrition Institute is championing this cause by making sure that health professionals like you and I are equipped with the tools that we need to make sure that non-communicable diseases become a thing of the past. What exactly are we going to be telling the people that we see every day in our practices? Well, we are going to be telling them that breast milk is best, because with breast milk you are sure that you are getting the right amount of protein, you are getting probiotics, you are getting everything that the child needs to make sure that they have a healthy, happy and full life. Breast milk is literally liquid gold. So advocate for breast milk at every opportunity. But for the infants who for one reason or the other, or for one circumstance or the other, do not get the benefit of breast milk, let's make sure that we are prescribing formula that contains the right amount of protein, not excess, the right amount, something comparable to breast milk. That being said, the health of women in a society must be taken as priority, because if women and women of childbearing age are undernourished, then they are more likely to give birth to babies who are low birth weight, and the cycle of non-communicable diseases is perpetrated. So making sure that nutrition, food security is absolutely secured for women especially will go a long way in stemming the tide of non-communicable diseases in our societies. To summarize, the origins of non-communicable diseases in adults have their origins long before the adult is even born. We as a community of healthcare workers have a responsibility to make sure that these diseases are prevented by interventions that we can institute even when a woman is thinking of getting pregnant. Thank you for listening.